Hello, my dear friends. I'm Dr. Emily Carter, a geriatrician and someone who has spent more than 20 years helping older adults stay healthy, independent, and confident about their care. Before we begin, if you find this information helpful, please like this video, share it with your loved ones, and subscribe to the channel so we can continue learning together, gently, wisely, and with peace of mind. And today, I want to have one of the most important conversations you may ever hear about your health. It's not a lecture. It's not a scare story. It's a heart-to-heart talk about something that affects every one of us. After we turn 70, I'm talking about routine medical tests, the ones doctors often order automatically, thinking they're helping us. But sometimes those very tests can cause more harm than good. Now, please don't misunderstand me. Medicine saves lives every day, but the truth is, after a certain age, some tests stop protecting us and start creating stress, false alarms, and risky treatments that our bodies may no longer need or even tolerate. And here's what most patients never hear. You have every right to ask questions before you agree to a test. You have the right to understand whether that test will actually improve your health or simply make you worry. Because when you know which tests are truly helpful and which ones might bring unnecessary harm, you're not just protecting your health, you're protecting your peace of mind, your time, and your quality of life. So welcome back to this safe space, a place where patient rights come before medical routine and where informed choice replaces blind obedience. Whether you're over 70 yourself or caring for someone you love, what we're about to discuss could spare you from medical interventions that do more harm than good, because here's the truth I've witnessed. Over 25 years in geriatric urology, there are 5 common medical tests that are overordered for seniors, tests that often lead to overdiagnosis, overtreatment, and serious complications. And yet, more than 90% of doctors never fully explain the risks versus benefits to their elderly patients. Today, I want to change that. So let's begin and talk about the 5 tests that every person over 70 should think twice about before saying yes. In over 20 years of medical practice, I've met thousands of older patients. Some carry folders full of test results, each page filled with numbers and scans, but in their eyes, I don't see reassurance, I see fear. One 76-year-old man once told me, "Doctor, every time I get checked, they find something else wrong." I smiled gently because I hear that almost every day, and that's why I'm sharing this message today, to speak honestly, but with kindness about the medical tests that may do more harm than good after age 70. Let's talk about the PSA test when finding a disease doesn't mean saving a life. The PSA test checks for prostate cancer, very common among middle-aged men, but after 70, the story changes. Large studies show that PSA screening in older men does not improve survival and may cause serious complications instead. Why? Because most prostate cancers at this age grow extremely slowly. You're far more likely to live with it than die from it. However, a slightly elevated PSA often leads to biopsy, then surgery, then radiation, and these treatments can steal away a man's remaining years, leaving behind infections, urinary problems, and depression. I've had elderly patients whisper to me, with tears in their eyes, "If I had known what I know now, I never would have taken that test." Ask your doctor these questions. Am I living with prostate cancer, or because of it? If the cancer grows slowly, do I truly need treatment? And if I choose to do nothing, could I still live happily for another 10 years? Next is colonoscopy when screening becomes a risk. Colonoscopy can be life-saving for middle-aged adults, but for those over 75, the balance shifts dramatically. As we age, the intestinal walls become thinner and anesthesia becomes riskier. The chance of perforation or bleeding is 3 to 4 times higher in people over 75. If your previous colonoscopies were normal and you have no new symptoms, you likely don't need another one. Instead, you can choose a stool blood test. Simple, painless, and safe. I'll never forget an 80-year-old man who said to me, "I did the colonoscopy to feel safe, but ended up in the hospital for a week." Medicine isn't just about finding disease, it's also about knowing when to stop searching. The last test I want to share is mammograph after age 75 when good intentions turn into burden. Many older women continue annual mammograms out of habit, but after 75, research shows, the benefits fade while the risks increase. Mammograms at this age often detect slow-growing cancers that would never cause harm. Treating them through surgery, radiation, or chemotherapy can reduce quality of life without adding more years. I've heard elderly women say, "Doctor, I'm more afraid of the treatment than the disease itself," because in truth, the pain and anxiety from treatment can take away the peace they deserve in their later years. Ask your doctor that. If the tumor is small and slow, will treating it extend my life or only take away my comfort? As you can see, health at an older age is not about how many tests we take, but about making wise, thoughtful choices. A test is only worth doing if it can truly change how your doctor treats you. Otherwise, it may only add more worry and fatigue. In the following section, we'll talk about 2 more tests to reconsider and the 3 golden questions every senior should ask before agreeing to any medical test. First test, tight blood sugar control when perfect numbers cause harm. I've met many older adults who obsess over blood sugar readings. They test every morning, worried when the number climbs above 7. I often tell them, my friend, sometimes a 7.5 is safer than a perfect 6.8. After 70, the body doesn't need perfection. It needs stability and safety. Strict glucose targets can lead to dangerous hypoglycemia, causing dizziness, falls, or even coma. Multiple studies show that overly aggressive sugar control increases the risk of death among frail seniors. The American Diabetes Association now recommends a gentler goal, keeping HbA1c between 7.5 and 8.5, depending on your health condition. Ask your doctor that. Should I aim for perfect numbers or a peaceful, balanced life? The second test is CT, MRI. PET when looking too hard creates fear. Many seniors are told, just do a full-body scan, better safe than sorry. But in reality, that phrase often brings more anxiety than safety. Modern scanners are so sensitive that they detect harmless shadows, tiny cysts, small nodules, minor spots that will never cause problems. Yet once seen, they trigger an endless cycle: biopsies, surgeries, repeat scans, often for findings that never needed attention. I remember an 82-year-old woman who told me, "I did a CT just to be sure and ended up with 3 biopsies. Now I'm afraid of hospitals." I held her hand and said softly, "Not every finding is a problem, and not every problem needs to be fixed." A major study in JAMA Internal Medicine found that 23% of elderly patients suffered complications from follow-up tests, yet none lived longer because of them. Before agreeing to a scan, ask, do I have any real symptoms? If something is found, will it actually change my treatment? And if I don't do the scan, am I really in danger? Here are 3 golden questions before any tests in old age. First question, what is my realistic life expectancy? And will this test truly make a difference? Second question, if something is found, will treatment improve my life or make it harder? Third question, what does real medical evidence say about this test for someone my age? My dear friends, after 70, health is no longer a race against time. It's a journey of clarity, peace, and self-awareness. None of us can live forever, but all of us can live fully when we listen to what our body truly needs. And sometimes the wisest choice is simply to stop at the right moment. If this message resonates with you, please like this video, share it with someone you love, and leave a comment below with your thoughts or questions. Thank you for listening with your heart. May you stay healthy, calm, and deeply at peace through every beautiful day of your golden years.